Hello, welcome back to another Family Bonds parent video session. I'm your host, Christian Ortiz. Um, so, through these video series, we're presenting different topics, on how to work with your teenager, from communication to behaviors. So now we're going to move into more of the mental health side of things. Um, and the biggest, the most common kind of things that we see with our teenagers are symptoms of anxiety and depression. So I'm just going to go straight in, because there's a lot to cover in this video. Um, sure. So you'll have access to this. I got this from the CDC, cdc.gov. Anxiety and depression is something that I think most people at one point in time in their life have struggled with. It might not be clinical depression where it's overly impairing, but you do see it, in certain people. What we know is that since the pandemic, we've seen a rise in anxiety and depression in our children and in our teenagers, and it could look a little bit different, right? So this little article is just talking about what that looks like, anxiety and depression and outgrowing fears and things like that. And so, one of the things, like I said, I'm not going to go into depth into this, but I would like you to kind of go back to this and see this. Is how does this look a little bit differently in teenagers and in children? Um, what we're tending to see a lot more these days are kids not wanting to go to school. So, from an anxiety perspective, this is a really big issue that we're seeing with our teenagers is, being very adverse to going to school. So, that's a very big, sign of anxiety, social anxiety, um, and that's a really, and they're fearful. They're fearful. Um, Another big anxiety that we see is, other people judging them. I think this is a pretty general, anxiety that a lot of our teenagers have. But how is this manifesting? This is manifesting in a lot of like, you know, nervousness. Some teenagers have very, panic attacks and deep breathing, really big fears, really worried about the future, just a lot of those different things that occur, right? And so you might see them isolate in their room or that kind of stuff. Um, so those are pretty typical things with anxiety. Some kids, some teenagers, it doesn't say it here, but will kind of self-medicate with like the use of marijuana, which is not something that we recommend. And the biggest reason we do not recommend that is because um, the concentrations of THC in marijuana are much higher because most kids are not smoking the natural, like bud and flower. And so, because of the higher concentrations of the marijuana or the THC in the wax, is actually making kids more anxious, which is making them smoke a little bit more. So, I mean, there's pros and cons, and obviously, our biggest fear is that they're laced with other drugs and fentanyl, which we have seen in the clinic. Depression, really with depression, lots of feelings of hopelessness, or you're going to see with depression with teenagers is it comes out in very irritable, right? A lot of irritability. Sometimes it can come out in anger and aggression, especially in males. Um, they isolate, they don't want to do things, they either oversleep or don't sleep enough. You might start seeing some potential self-harming behaviors. And what I mean by self-harming behaviors is we do see our teenagers will tend to cut themselves. I want to caution you, right, that more often than not, kids who cut themselves are not trying to kill themselves. That's not to say that if they don't cut, that they could put their life at risk or that there are a few times where I've seen kids cut who want to kill themselves that way. The majority of the time, I would say they use it as a coping skill. And it's an effective skill. It really helps them get their mind off of maybe some negative thoughts and they redirect their mind to, cutting or feeling a blade or looking at the blood. And so the best way I can describe cutting behaviors is if, someone who's ever smoked, it's not good for you, but it's an effective tool, right? When you're really stressed and you can take a smoke, it takes your mind off of it. It makes you feel better. So what we do, in the therapeutic world when it comes to treatment with these things is we take a self-harm reduction approach. And we do that also with substance use and so on and so forth. So, the treatment for anxiety, depression, obviously, we would want you to think about doing some therapy. Um, you know, One of the things people will always tell you is about cognitive behavioral therapy. It's not the only therapy out there. We do dialectical behavioral therapy, acceptance and commitment therapy, family therapy. We do EMDR, which is a trauma therapy if there's trauma involved in this. So therapy can be really, really effective. But, we would also consider, depending on the severity, right, of the symptoms and the amount of symptoms, how long it's been happening, we would probably recommend that, a teenager see a psychiatrist for medication management. And typically that looks like an SSRI or an antidepressant. Now, there's a lot of taboos, right, about medication and what that looks like, if they're needed. So I will let you know that, and for anxiety and depression, particularly with antidepressants, it's not an addictive medicine. So it's not something that someone can get hooked on, right? Um, and I think that's a big fear. Also, there's this fear that you'll always have to be on this medication for the rest of your life. And that's not necessarily true. If anything, most people find therapeutic effectiveness, within 9 months to a year, sometimes a little bit longer, depending on the situation. And then they work with their psychiatrist to wean them off of the medication because once the serotonin builds up in your brain, you're able to tap into other different activities and feel better. It's like, oh, well, now I'm exercising, now I'm sleeping better. And all of those activities, right, help with your mental health and help with your anxiety and depression. But sometimes it's really hard for people to kind of get over that hump. So that's where medication can be really beneficial. So this is an article from Harvard. You know, and you can see it up here. The mental health crisis among children and teens, how parents can help. So this is really talking about how there's a national emergency amongst teenagers and teens. We did see an increase of suicide attempts. We did see increase of kids not going to school. So we call that chronic absenteeism. A lot more self-harm, a lot more drug use and things like that. And we do know that that was particularly, it's always kind of existed, but it was enhanced during the pandemic. Okay. So this article particularly is not talking about the symptoms of anxiety and depression, but more so how you as parents can help, right? So one of the things that we're always going to talk about is like, the three or four legged stool, right? Physical exercise, nutrition, um, and sleeping. And then the last one, what is it? Like getting sunlight or spirituality or whatever that looks like, right? So physical health is one of them that you really want to be sure that you pay attention. Oh, it says mental health is just as important as physical health. Oh, okay. So I guess this is talking about normalizing mental health. Okay. So a lot of times people feel like because they're struggling with depression, anxiety, or some sort of mental health that they're flawed. So if you remove the stigma of mental health and you go, yeah, well, I've gone through anxiety and depression. This is how I dealt with it. Like, let's talk about it, So we want to be able to let them know that you can still be awesome and great, right? And still, struggle with mental health. Both things can be true. Okay. So paying attention to those kinds of things, and the more you normalize it with your children and your teenagers, the more likely they'll feel safer to talk to you about it. Now, I'm a parent of 4 kids. Remember, they don't like talking to me about this stuff, right? And I'm a therapist. So there might be a time, where they might be open to it, but they might not be open to it with you, but they'd be willing to see a professional. Great, as long as they talk to somebody, right? Create rituals of communication and safe spaces to talk. Make sure that they have downtime. Sometimes you know, kids are overscheduled, and even some of our teenagers, like they're like straight A students. They do sports, they work, they do all these things, and they are full of anxiety, and it gets to the point where it impairs them in their relationships, and they don't feel good about themselves, but they feel this need of, you know, being overscheduled. So please allow them to have that opportunity for downtime and for yourself, right? How can we role model this for our teenagers? It's like we have to take care of ourselves first and to be able to do the things that we want to do. Encourage healthy media habits. We're going to go into depth in the next video with digital safety. Make sure your child is getting enough sleep, and also leave room for exercise, right? Um, our teenagers should be sleeping ideally 10 to 12 hours. We want them to get at least 8, okay? Now, there's also this concern of oversleeping, okay? So, insomnia is when they are not sleeping, and hyposomnia is when they're oversleeping. And we really want to make sure that their circadian rhythm is attached to sleeping at night, being awake during the day, for a lot of number of different health benefits, which include mental health, but most teenagers are in school, so we need them to be able to be awake during the day. Um, Keep in touch with teachers, coaches, other adults in their life. Make sure to have a judgment-free, safe haven in the home, and pay attention to your own mental health. Okay. I'm sorry if I'm feeling like this is being sped up, but again, there's a lot to cover in this little video. Okay. So again, this is a nice little article. Um, the thing that I think is something that's really scary, but something that's really important is how can we prevent a suicide from being completed? Okay. So suicidal ideation is something that's more common than you think it is. Most people have thought about it at one point in their life. But it's a passive thought. It just kind of like comes in and goes out. Like, oh gosh, I just wish I weren't here, or I'd be better off, you know, if I just disappeared. Like people don't say like if I died, but they just don't want to be here, and so it can come off as like, a lot of stress or something like that. And so that's very, very common. Okay. So from there, most people have thought about it. And when I talk to kids and I'm open about it, most of them will tell me like, yeah, I've thought about it, but I never do it. And I really don't think about it more than that one time or that second time or something like that. Now, from there, it kind of varies, right? Some people have chronic suicidal ideation every day, and it's part of their baseline, and they know that they're not going to do it, and they learn how to manage it. I would say that that's not as common. Okay. So this is a tool called QPR, question, persuade, and refer. I won't be able to go through all the examples. I'm just going to take you through the skills. So QPR is very similar to CPR. So CPR, right, is if someone is passed out, they're unconscious, you would start chest compressions and maybe doing some rescue breaths. I'm going to sneeze. I'm so sorry. Um, and then from that point forward, your job is to ensure that they get further care, right? You call 911, You get the medical professionals to come in and save this life. So QPR is a very similar concept to CPR, where it's the very first step. It's the very first step in helping save a life, and hopefully preventing someone from trying um, to complete a suicide. Um, QPR is not intended to be a form of counseling or treatment. It is intended to offer hope. Okay. So here are some suicide myths and facts. I'm going to give this to Susie and or Kyla to give to you. So you have this with you. So it's just going over some myths and facts. So the biggest myth is that, oh, well, once someone's made up their mind, you can't stop them. Or if you talk to them about suicide, they'll do it. That's absolutely a myth. Once you ask the question, it lowers the anxieties and people want to talk. Okay. Um, Here's some warning signs. You're going to get some very direct clues, like they tell you. I wish I were dead. I want to kill myself. I want to end it all. Take this seriously. And you say, okay, well, how would you do it? When will you do it? Why do you want to do it? Let's get you some help. I really care about you. Sometimes you will see people use this as, I don't know. I guess the biggest example I can think of is like in abusive relationships where a partner may use these words to keep their partner from leaving and in domestic violence situations. But even in those situations, with inner partner violence, that partner could do something, right? And so in that situation, I'd probably tell someone, get that person help. But also, it would probably be safer for you to leave that relationship. More often than not, people won't be indirect. They're going to be more direct. They're going to be more indirect, right? Like you're going to, oh, I just don't want to be here anymore. I'm just so stressed. I'm so tired. I just want out. I don't want to be around much longer. So if at any point in time your gut is like, this doesn't feel good, you're going to want to ask them. Okay. Of course, we have behavioral clues. They've had previous suicide attempts. They're, acquiring a gun, or you see that all their pills are missing and, you know, something like that. They might have co-occurring, depression, moodiness, hopelessness, addiction. They start giving you things, their prized possessions. You're like, that's weird. A sudden interest or disinterest in religion, or maybe they've been sober for a really long time and they relapsed, or they're drinking more excessively. Unexplained anger, aggression, and irritability can be behavioral clues. Of course, situational clues is something happened, right? The breakup of a relationship, the loss of somebody, being fired from work, being expelled from school. Of course, the loss of a loved one by death. Maybe you got a diagnosis, of a serious or terminal illness, financial insecurity. I mean, a number of different things could be situational clues that might lead someone to try and attempt to complete a suicide. So, when it comes to QPR, one of the things to think about is like if you think that you don't know, just ask, okay? Because then that person will tell you. And I'm a therapist, I'm a clinician, and I have family. I've been very strict, like, are you thinking about killing yourself? I'm much more of being direct and blunt because I've noticed that that's what works best, right? Because then they're like, no, this is just what's going on with me. Well, I worry about you. I worry that that's something that you think about, right? If they're being really reluctant and you're still kind of like something's up, be persistent, talk to them in a private setting, allow them to talk freely, don't be like, looking at that's what we do as therapists. We only got an hour, right? Don't be like, oh, you only have an hour. Talk to me. Be open to allow them to speak. Um, have resources handy, call 211, which is our crisis line in the state of Arizona. You can also call 911. They may or may not help. Or you can always take them to one of our behavioral health hospitals in town, Sonora Behavioral Health Hospital, which is over by Northwest, or Palo Verde Behavioral Health Hospital. There's also the Crisis Response Center on Ajo. So those are the three places you can physically take somebody. Okay. So the very first thing is, well, ask the question, right? Have you been unhappy lately? Have you been so unhappy lately that you're thinking about ending your life? Do you ever wish you could go to sleep and never wake up? That's a little bit indirect, if you feel a little uncomfortable asking it. Again, I like more of the direct approach. I literally say, are you thinking about killing yourself? Um, you can say, some people who are as upset as you seem to be, they sometimes wish they were dead. I'm wondering if you're feeling that way too. Okay. This one, you look pretty miserable. I don't know if I like that language, but I would say, you look really sad. You look like you're heartbroken. I'm wondering you're thinking about suicide. How not to ask the question, you're not suicidal, are you? um, and partly because that sounds very judgmental, right? Like in the moment you bring judgment into the question, they're likely to shut down. Okay. So then the next thing of QPR is, well, you ask a question, then you persuade them. You persuade them to stay alive. Listen to the problem, give them your full attention. They think that suicide is the only solution to an unsolvable problem, right? Which is typically not the case. Typically, there's, different situations that can happen, or you can learn from those experiences or something like that, right? Don't rush to judgment and always offer hope. Even if it's the slightest thing that they can cling on to, that's how you want to persuade them. Then you want to persuade them to help to go with you to get some help, right? Will you go with me to get some help? Oh, let me help you get help. Or get a promise out of them. Will you promise you will not do anything until we find something, right? Your willingness to listen and to help can rekindle hope and make the difference. Then, of course, the last part is R, which is you want to refer. Like in CPR, right? If we're doing CPR, we're doing first aid, we're going to want to refer them to see a medical professional, right? We call 911, get them seen. So, more often than not, you're going to want them to go talk to somebody, right? So, this could be, taking them to the hospital. If they have a plan and an active plan and they want to do it, I would take them to the hospital so they can be monitored and they can be looking at medications. If they take medications, put them in a safe space. If they've already taken pills and they've overdosed and you found out, of course, you have to take them to the hospital so they can be monitored and so on and so forth. Um, you can always get them, like, maybe they're not that bad and they're willing to talk to somebody. Well, let's find a therapist that you can start talking to. Um, if they're kind of like, no, I promise I'm not going to do anything. I just need a rest right now, that kind of stuff. Give them referral information. Give them the number to 211, which is the Arizona crisis line where they can talk to someone. Someone can even go out to the home and see them if need be, and just ensure them that you're there, willing to help them if something happens. Okay, willing to get help. Remember, instead of an attempt, since almost all efforts to persuade someone to live instead of attempt suicide will be met with agreement and relief, don't hesitate to get involved or take the lead. So most people are scared, right, to do the QPR because they don't know what the reaction will be. More often than not, people feel relief that someone saw them. Okay. For effective QPR, say, I want you to live, I'm on your side, get others involved, family, friends, pastors. Um, all right. So, and one of the last things about QPR is, let me stop my share. If you feel like you can't ask the question, please find someone who will. Okay. All right. Again, if you need any further information from me or have very specific questions, you can reach out to me by email christiano@elrio.org.